Welcome back in. Our final segment here on WAJR's Ask the Experts, brought to us by HealthWorks Rehab and Fitness. Our topic today, understanding treatment of low back pain. We're joined by Amy Lancaster, who is the clinical director of HealthWorks Rehab and Fitness's location in wild, wonderful Westover, and Dr. Matt Lively from Morgantown Orthopedic Specialist, Primary Care, Sports Medicine. So we've talked about the back as what it is, why we have problems with it. We talked about, okay, what are treatment options? Now the big question here is, when do I go see Matt? When do I go see Amy? In other words, when's it time for the doctor? When's it time for physical therapy? Matt, how would you kind of make that determination as to when's the time to ring it up and say, I need to come see you?
So the most garden variety back injuries, like a sprain, strain type of thing, will resolve fairly quickly with minimal treatment in general. So I think if you just if you bend over, your back's tight, you have a little bit of spasm, it's not, it's just localized in the back and it's not debilitating in the sense that, then I think you can self-treat yourself at home for a few days, some ice, heat treatments, maybe some over-the-counter medications, and most people will get better. If you're not getting better, within a few days, or certainly if it's worsening, or if you start having if you at the time or later you start having symptoms like leg pain, especially weakness in the leg or numbness or something like that in the leg, then you probably need to see somebody faster than you otherwise would, and that would either be coming to a physician's office, either your PCP's office or someone like us. Many people will go to urgent care and so forth for an initial evaluation, then end up getting referred to us. But I think that if it's just a little bit of a nuisance kind of thing, you can treat yourself. If it's any more debilitating, especially if you have radicular symptoms, then I think that's something you need to have addressed.
Amy, the physical therapy aspect of it, can people come straight into HealthWorks? Do they need to go to a doc first? How's that work?
So physical therapists have direct access, which means that we are allowed to see people without a physician script. Unfortunately, the majority of the insurance companies do require the physician script. So for most intensive purposes, other than a few insurances, our patients do need to see their physician first, make sure that they're actually appropriate for physical therapy, and then come in with their physician script for us.
To kind of do an overview of this then, chances are that you're going to have an issue with your back. Unfortunately, for those of you that are out there listening, at 80% people at some time, the question becomes how significant it can be. Is it going to be in that lower back? Is it going to be in the middle? We need to even jump in to arthritis at all, Matt, but obviously that's an issue as well, right? As you said, if hardworking people out there have been lifting their entire life, is it a matter of time before, as you called it, the jelly donuts inside that spine that have been a shock absorbers, it gets worn out, and that's when you have problems, right?
The jelly dries out. It starts to dry out. That's degenerative disc disease. The jelly dries out and becomes more like a hard-boiled egg kind of thing, and so it loses its cushioning support, and it can lead to further problems and pain.
Anything besides exercise that can be preventative or helpful, supplements, vitamins, anything at all that you've ever seen that would have any sense of, hey, this will maybe help?
Well, there's always people trying different types of supplements, and the data on those come and go. I mean,
Right.
It's like, so I can't tell you there's one supplement that's best. I will say that one thing is both a treatment and a secondary prevention for low back pain that has been shown is actually just regular exercise, like walking. If people that can walk, or ride a bike or swim, all which puts very little stress on the low back. If you can do that for at least half an hour nonstop, once a day, every day, those individuals have less trouble with back pain and have less flare-ups of back pain later on if they do have a problem. And so one of the secondary preventions I tell people, just go out and walk. And it's not only good for your back, it's good for your health in general.
Yeah, sounds good. Sounds like a plan. Amy, thank you so much for being with us. Good to see you again. Matt, we appreciate it. If you're dealing with low back pain, if you're dealing with any kind of pain for that matter, these are the folks that can help you out. Matt Lively, Mountaineer Orthopedic Specialist. He is helpful there on the primary care side in sports medicine, along with Dr. Bill Post. And you've been listening to Amy Lancaster as well. She's at the Westover location of HealthWorks, and obviously they've got locations all throughout the area. If you have that issue, as they say, when your body hurts, then go to HealthWorks. Guys, thanks so much for being with us.
Thank you, Tony.
Thanks, Tony.
All right, and thanks for being with us, everyone. WAJR's Ask the Experts. Stay with us. More coming up here on WAJR.